Have you ever looked in the mirror and noticed a new pimple right next to an old dark spot? You treat the pimple, but then it leaves a mark. You try another cream, then another home remedy, and somehow your skin looks even more irritated. If this sounds familiar, you're not alone. Acne is one of the most common skin problems, and the dark marks left behind after pimples can sometimes take weeks or even months to fade. But here's the important part. You don't need dozens of expensive products, and you definitely don't need to burn or aggressively scrub your skin. In this video, we're going to talk about what actually helps acne, what can help fade dark spots, which ingredients are worth considering, and which popular home remedies you should avoid. We'll also build a simple morning and nighttime routine that you can follow consistently. So if you struggle with pimples, acne marks, or uneven-looking skin, stay until the end. Because the biggest mistake people make isn't using too little. It's using too many things at once. Before treating your skin, you need to understand the difference between acne and the marks acne leaves behind. A pimple is an active skin problem. A dark mark that remains after the pimple disappears is often called post-inflammatory hyperpigmentation, or PIH. These are not exactly the same thing. If you only focus on the dark marks while new pimples keep appearing, you may continue creating new marks. That's why the goal should be two things. First, reduce new breakouts. Second, gradually fade the marks that remain. And there's another important point. Not every dark spot on your face is caused by acne. Some spots can come from sun exposure, irritation, hormonal changes, or other skin conditions. So if a spot is changing, bleeding, painful, rapidly growing, or looks unusual, don't try to treat it yourself. It's better to have a dermatologist examine it. One of the biggest mistakes people make when they get acne is trying to destroy it. They scrub harder. They squeeze pimples. They apply several acids. They use strong DIY mixtures. And sometimes they even use things like lemon juice or toothpaste. Please don't do that. Your skin is not a dirty surface that needs to be scrubbed clean. Aggressive treatment can irritate your skin and potentially make dark marks look worse. Instead, think of skincare as a long-term process. Gentle plus consistent plus appropriate ingredients equals better results. You shouldn't expect overnight transformation. Healthy skin takes time. If you're serious about fading dark marks, sunscreen should not be an afterthought. It should be part of your morning routine. Why? Because UV exposure can contribute to pigmentation and can make uneven skin tone more difficult to improve. Look for a broad-spectrum sunscreen with SPF 30 or higher. Apply it generously and reapply when appropriate, especially when you're outdoors, sweating, swimming, or spending extended time in the sun. And here's a simple way to think about it. Your nighttime products may help improve your skin, but during the daytime, you're also protecting your progress. If you spend hours outside without sun protection, you may be making it harder for dark spots to fade. So don't think of sunscreen as something you only need at the beach. It's an everyday skincare step. Now let's talk about a popular home remedy, aloe vera. Aloe can feel soothing and may help moisturize irritated skin. But it's important to understand what aloe vera can and cannot do. It shouldn't be presented as a miracle acne cure. If you enjoy using an aloe product, choose one that's designed for facial skin and avoid products containing ingredients that irritate you. And always remember, natural doesn't automatically mean safe. Your skin can react to natural ingredients too. If something burns, causes significant redness, itching, or swelling, stop using it. Now let's talk about some viral skincare hacks. You may have seen people recommending lemon juice for dark spots. Don't do it. Lemon juice is acidic and can irritate your skin, and irritation can make pigmentation problems worse. Another common suggestion is toothpaste on pimples. Toothpaste is made for your teeth, not your facial skin. It can irritate and dry the skin without being a proper acne treatment. And then there's baking soda. Again, your face isn't a kitchen experiment. Your skin has a natural barrier and a specific pH. Using harsh household ingredients can disrupt that barrier. So before you try a viral skincare hack, ask yourself, Was this actually designed for facial skin? If the answer is no, think twice. Here's another rule that's incredibly important. Don't constantly squeeze or pick your pimples. I know it's tempting. You see a whitehead in the mirror. You squeeze it. It looks smaller. But the story doesn't necessarily end there. Picking can increase irritation and inflammation and may increase the risk of marks or scarring. Instead, use an appropriate acne treatment and give it time. If you frequently get large, painful, deep pimples, that's another reason to speak with a dermatologist. Sometimes over-the-counter skincare isn't enough. Now let's create a simple morning routine. You don't need 10 steps. Step 1. Gentle cleanser. Wash your face with a gentle cleanser. Don't scrub aggressively. Step 2. Treatment. If you're using a morning acne treatment, use it according to its directions. Don't layer multiple strong actives just because you want faster results. Step 3. Moisturizer. Use a moisturizer that's appropriate for your skin type. Even oily and acne-prone skin can benefit from proper hydration. Step 4. Sunscreen finish with broad-spectrum SPF 30 or higher. This step is especially important if you're trying to prevent and improve dark marks. That's it. Simple. At night, your routine can be just as simple. Start with a gentle cleanser. Remove sunscreen, makeup, sweat, and daily buildup. Then use your chosen acne treatment according to its instructions. If you're using Adapalene, for example, follow the product directions and start gradually if you're new to it. Then moisturize. And here's something important. You don't need to feel burning or extreme peeling for a product to work. Pain isn't proof of effectiveness. If your skin becomes severely irritated, simplify your routine and consider speaking with a healthcare professional. Consistency beats aggression.